It's Wisconsin Today. I'm Rob Farrett. Last week, the Wall Street Journal reported that the Trump administration is debating whether to close the Centers for Disease Control and Prevention's HIV Prevention Division. That provides $1.3 billion to track infections nationwide and promote HIV prevention and testing. That comes as the Trump administration stopped the distribution of HIV medications by U.S.-backed foreign clinics in January, disrupting treatment for millions around the globe, and AIDS researchers around the country report that federal grants have been cut off for their work. What could all of this mean for HIV prevention, treatment, and research here in Wisconsin? Bill Keaton is Vice President and Chief Advocacy Officer at Vivint Health. That's an organization based in Milwaukee that delivers HIV prevention care and treatment services. Bill, thanks for joining us today.
Rob, thank you for having me. I appreciate it.
Can you start by telling us what your organization does for people living with HIV when it comes to prevention and treatment?
Yeah, of course. Vivint Health is a statewide organization that is delivering medical care, dental care, pharmacy services, mental health services, wraparound services like food pantries, housing, and case management services to about one half of the 8,000 people living with HIV in the state of Wisconsin. We also provide prevention services to tens of thousands of folks in our state who are vulnerable to acquiring HIV. And those services that are reaching folks who are most at risk and most impacted by HIV are some of the programs that are potentially going to be impacted by the plans being discussed by the Trump administration.
Yeah, this division of HIV prevention, as I mentioned, over $1 billion in prevention funds back in 2023 around the country. How important is that to the work that you and similar organizations around the country are doing?
So here in Wisconsin, Vivint Health receives about $1.9 million out of that roughly $1 billion that you indicated. And that's just a portion of what the state of Wisconsin receives to do HIV prevention work. With those dollars, we are able to do broad-based HIV testing services to help diagnose individuals who may be living with HIV, which affords us the opportunity to immediately link them into care and treatment services that can help them live a long and healthy life. And if we find that that person is not has not acquired HIV, we can then continue to deliver effective HIV prevention programming to those individuals, including something called pre-exposure prophylaxis, or PrEP, which is a biomedical intervention. It's the use of a medication that is typically used to treat HIV, but prevents acquisition of the virus by individuals who may be exposed. And these programs are being are helping to realize really good success in the United States. From 2018 through 2022, we've seen a 12% annual reduction in the number of new HIV diagnoses across the country. These programs are clearly making a positive impact as our nation continues to achieve a longstanding goal of ending HIV as an epidemic in our country.
Now, as with a lot of things happening in the nation's capital now, this is kind of a moving target. This report that this division could be cut, or some of the funding and prevention services might be reassigned, or TBD. What is your understanding, Bill, today of the current status of this funding?
You know, that's one of the really frustrating aspects of this. As an organization that is working to save lives, literally working to save lives and help people be as healthy as they can be. The current environment in Washington is creating a great degree of uncertainty. We rely on this $1.9 million in funding we receive as primarily the only source of funding that we have to deliver these prevention services. Were these services to be moved, or were they to be a significant reduction in the workforce at the CDC? What that means is that not only are we disrupting the care and treatment and prevention infrastructure within our country, we're losing potentially, hundreds, if not thousands of years of collective experience and professionalism with a workforce that greatly understands what folks need on the ground to be successful in doing this work. And in a very real perspective, it means we run the risk of going backwards in our nation's work to reduce HIV transmission at a time, quite frankly, when we have all the tools We have the science. We know how to prevent HIV acquisition. What we lack are the appropriate levels of resources to get those services and interventions in the hands of individuals who need them the most. This is a very concerning time for the future of HIV prevention, care, and treatment.
You released a statement last week saying, hey, this might save money in the federal budget in the short term, but you argue this could increase our costs in the future for healthcare. What do you mean by that?
Yeah, correct, Rob. So what we know is that for every new HIV diagnosis, the individual who's being diagnosed with HIV is going to um, realize about $500,000 in lifetime healthcare costs just associated with effectively managing their HIV, and that includes the expensive medications that are used to effectively manage the HIV diagnosis. It includes hospitalization. It includes other associated healthcare costs that come with disease progression with HIV for folks who might be diagnosed late, which is one of the challenges we continue to have in this country. And so all of those costs, when folks show up to the emergency room or their community health center or their clinic like Vivint Health, we're going to make sure that those individuals have access to all of the care and treatment that they need. What we know is that those costs will be borne by someone if they're not the federal government through these programs and through effective prevention. It'll mean increases in private health insurance rates. It'll mean additional costs within large healthcare systems, and ultimately we know that those costs in terms of charity care and other programs like that ultimately get borne out by whether it's taxpayers or American healthcare consumers.
We're talking about federal cuts to HIV research and potential cuts to prevention and testing funding, what it means for Wisconsin. Bill Keaton is with us in Vivint Health, based in Milwaukee. Want to turn to a couple of those other topics. I'm sure you're watching, Bill. A lot of researchers who work on HIV treatment, things like that, saying their federal funding has been stalled or canceled. Apparently, what are your concerns with the impact on that research?
Yeah, thanks, Rob. A little bit of background on me. I got my undergraduate degree in biochemistry and molecular biology and did research that was partially funded by this as an undergrad that was targeting one of the enzymes in HIV. That target is now a part of our comprehensive approach to effective disease management for folks who are living with HIV. The fact of the matter is, we continue to see incredible advancements in pharmaceutical interventions and treatment for folks living with HIV. We have what are known as long-acting injectables that are coming to market that move from a one pill once a day treatment modality to an injection that someone might be able to take once every 3-6 months. Making sure that new medications remain in the pipeline and making sure that there's research to bring those new treatments to market is incredibly important. As we know, HIV continues to evolve. The treatments need to continue to evolve with the changes that the virus makes and when we learn more about how the body responds to it. Now is not the time to go backwards in the fight against HIV. We need to ensure that we're delivering the resources as a nation to really meet the challenge. And there are a lot of great scientists out there who are doing work every day that are bringing just incredible interventions and treatment to market. And it would be a shame if we lost that momentum.
Further from home, the PEPFAR, the President's Emergency Plan for AIDS Relief, started under the George W. Bush administration 2003, halted under review, but apparently many contractors not receiving funding as far as I could tell right now. How big a concern is that in the wider struggle against HIV and AIDS?
That's a great question. What we know is that in a number of nations, PEPFAR is the lifeline for folks living with HIV. It is the program that makes sure that they have access to all those medications that we were just discussing. What we also know is that as a virus, HIV doesn't care about geopolitical borders. It doesn't care about arbitrary lines drawn on maps. And given the global society that we have, the fact that folks are able to move from country to country, from community to community, is not going to stop. And so when we think about how we approach addressing HIV as a nation and as a global leader in this fight, we need to be really mindful of the fact that this is what is helping to keep millions of people across the world, not just here in the United States, but across the world, safe and healthy.
And Bill, in our last minute or so, if this federal funding under the CDC for HIV prevention and testing here in Wisconsin were to dry up, were to go away, do you have other avenues you would be trying to seek to at least backfill some of that funding?
Yes, we have a great partnership with the Wisconsin Department of Health Services, and response to HIV has been something that has been a bipartisan, or frankly, a nonpartisan issue for a number of years. Quite frankly, I don't believe that the state of Wisconsin is in the financial position to completely backfill the loss of millions of dollars in federal funding. We will continue to work with them. We'll continue to work with our private philanthropic community partners. But make no mistake, that 1.9 billion here for Vivint, or 1.9 million here for Vivint Health in Wisconsin, and $1 billion across the United States is not something that we will easily be able to fill in through state and local investment or private philanthropic investment.
Bill, we'll leave it there. Thanks again for joining us today.
Thank you, Rob. Appreciate it.
That's Bill Keaton, Vice President and Chief Advocacy Officer at Vivint Health. That's an organization based in Milwaukee that delivers HIV prevention, care, and treatment services. Been talking about potential federal cuts to AIDS prevention funding, how it could impact Wisconsin. Want to hear from you. Have you relied on some sort of publicly funded outfit to get AIDS testing, AIDS treatment, or maybe a loved one has? Or if you work in healthcare, how important is this kind of prevention and treatment to your work and the patients you serve? Let us know. Email wisconsintoday@wpr.org. That's wisconsintoday@wpr.org. Next on Wisconsin Today. Over a century ago, Wisconsin led the nation in compensating people who were wrongfully convicted of crimes. Not so today. That compensation hasn't changed in decades.
If you do the calculations, then there's no way in the world that number shouldn't be somewhere around $50,000 to $75,000 to $100,000 a year. It's just right.
We'll break down the numbers next on WPR News. Here's Wisconsin Today. I'm Rob Ferret. Over a century ago, Wisconsin became the first state to provide compensation for people who served prison sentences for crimes it turned out they hadn't committed. At the time, the maximum award was $5,000. That'd be roughly $160,000 in today's money. Wisconsin's wrongful conviction compensation has been updated once in 1979. According to a new data analysis, Wisconsin has gone from being at the forefront of this issue to having the second lowest compensation rate nationwide. Khushbu Rathore is a fellow at Wisconsin Watch and ran the numbers. She talked to Kate Archer-Kent last week.
Not every state has wrongful conviction compensation. Lay it out for us. What is this money and when is it dispersed?
Yeah, so the federal standard is that people who were put in federal jail, at least, and were later found to be innocent or exonerated, according to the federal government, they're entitled to some amount of compensation for each year they spent in prison. And so the federal standard is $50,000 per year. In Wisconsin, the standard is $5,000 per year up to a maximum of $25,000, which I found absolutely mind-boggling when I first heard about it. You know, the maximum Wisconsin allows is half of the federal standard for a single year. And then you have people who are in prison for decades who are not getting really any support when they're released and they were innocent.
How do we compare to other states, though?
Really, really terribly. The only state that's worse than us overall is Montana, and that's because Montana only provides education assistance, so they don't provide any monetary compensation. Of the states that provide monetary compensation, we are by far the worst. We provide $4,200 per year loss to exonerees, and this is just the exonerees who were paid. And there are many who either don't apply or don't get any payout.
What is the role then of the Wisconsin Claims Board that can recommend additional compensation? When do they step in?
All the claims will go through them, and they, in the letters that they have that show the results of the claim, they'll show here's what the exoneree said, and then the district attorney office in that county will usually have their own little piece. Sometimes the district attorney will say nothing. They'll be like, it's up to the claims board to decide. Otherwise, sometimes they'll say, yeah, we don't think this person is innocent, or, their evidence isn't clear and convincing. And so the claims board gets to decide on their criteria, which is the evidence clear and convincing that this person was put in jail incorrectly and that they are innocent? So there's this huge distinction there of you can be exonerated because of a vacated judgment or because of legal issues when it came to your trial, like your attorney was incompetent, or in one case, there was someone who was chained down during his trial, and the jury could see that, and a federal judge later said, we need to vacate his judgment because of that. But the claims board said, just because that happened doesn't mean you were innocent, and you can't prove your innocence, even though you have messages from the people who you say committed the crime, saying that they committed the crime and you weren't involved. Like, that's not enough evidence, so you don't get any payout.
It sounds like the Wisconsin Claims Board wields sweeping a lot of power.
They do. They basically have all the power in the situation, and in some cases they do recommend, if a person has been in jail for an extremely long time, they can recommend that the legislature provide extra money. So in some cases, people have gotten over $1 million and over that $25,000 limit.
Does this compensation or this cash payout include anything other than money?
It does not. They can apply separately in the same document, but as a separate category for attorney's fees. But other than that, a lot of other states will provide things like help with healthcare for the first few years, help with reintegrating into society, help with higher education, housing. Wisconsin provides none of that.
Can you open your reporter's notebook for us? What tipped you off on this story? Where did you begin with the data?
I just landed on the Wisconsin Claims Board website somehow, and I saw that they had a separate listing for innocent conviction compensations. And I started looking at that, and it was not in any kind of data set. It was just every single document that included one of those. And you kind of had to scroll through all the legalese to find the actual information about how much was requested, how much was given, why it was denied. And so I decided to take that information, and I kind of realized, okay, well, the claims board data is only really going to show people who did apply. So I started looking for other sources for people who have been exonerated, and I found the University of Michigan Law School's National Registry of Exonerations. And so I decided to kind of filter down to just 2005 onwards, kind of get a 20-year look at it. And I also found another source called For Justice. I compiled those three into my own kind of database. And then I also used a data set that the National Registry of Exonerations kind of compiled about each of the states and how they stack up to each other.
And along the way, did you figure out how often Wisconsin is denying compensation for years spent in prison?
I did. So it was more than half, but a lot of those people didn't receive the full amount they asked for. They may have received very minor amounts or really just attorney's fees in some cases.
Is there any state legislation in the works or any efforts by lawmakers to change this system?
So there were, and that's kind of what continued to make me want to push through the story is seeing, okay, so there were attempts in, I believe it was 2016, and 2017 to create legislation that would raise the ceiling for innocent conviction compensation. And it made it through the assembly with no problem, but then it stopped at the Senate. They just never pushed it onto the floor. And I talked to State Senator LaTanya Johnson from Milwaukee, and she mentioned, there's just kind of no appetite for the bill. They don't think that it would pass right now. And we both kind of agreed, it's a really common sense bill. People who are getting out of jail after being exonerated shouldn't have to just go out into the world and it'd be like, we took your entire life away, but here's $25,000. But there's not a lot that the legislature wants to do about it.
Khushbu, thank you so much for joining us.
Thank you for having me.
Khushbu Rathore is the Roy W. Howard Fellow with the nonpartisan investigative newsroom Wisconsin Watch. She recently published a data analysis of how Wisconsin compensates people who are wrongfully convicted. As we look more closely at the impact of wrongful conviction compensation, we turn to Jarrett Adams. In 2000, a Wisconsin court wrongfully convicted and sentenced Adams 28 years in prison for a crime he did not commit. Adams is an attorney and exoneree specializing in criminal defense, civil rights, and wrongful conviction cases in state and federal courts. His memoir is called Redeeming Justice. Jarrett, welcome to Wisconsin Today.
Thank you so much for having me. Glad to be here.
You were denied compensation in 2009, 2 years after being released from prison. The Wisconsin Claims Board said in your case it lacked clear and convincing evidence. Can you recount that story?
Yes. 17 years old. I am born and raised in the state of Illinois. I go to a party in Wisconsin, falsely accused of a sexual assault, wrongfully convicted based on police withholding evidence from a witness that would have exonerated me. I ended up getting the Wisconsin Innocence Project to take on my appeal. We appealed. The court unanimously overturned my conviction based on my attorney failing to investigate, and not what I previously mentioned, not the fact that the police never turned it over, which was a statement from a witness that assisted in my exoneration. So the conviction's reversed. I come home, but the damage is not reversed. I get out and I'm staying with my mom and my stepfather. And I'm not out until I'm 26, turning 27 years old. So the impact of what was taken from me was definitely felt. But I started to look up after that decision. That decision compelled me to be where I am today. I took that decision to mean more than just I couldn't by clear and convincing evidence, because I started to go back and read all of the other cases as well that were denied, and it was pretty much if you didn't have DNA clearing you, or you didn't have someone else, standing up and saying I did it, or the actual accuser saying you didn't do it, they would deny all of them. I mean, even though evidence would be overwhelming in innocence. So to me, when they denied me, I didn't just take that as a denial and it's just, how they felt. I took that as another direct attack to take more of my life from me by watching me fail.
When you're ultimately freed from prison, what is your situation like? Where did you find stability and income?
So I ended up, I started with my mom's and my stepfather's network of people, literally cleaning gutters. If it was wintertime, shoveling snow. This is when TVs were being hung on walls. So I would go around and hang people's. I did whatever I needed to do during the day so that I can get through school at night. I can remember this even more vividly. It wasn't just when they denied me. Um, they denied me, and then afterwards, one of the board members told me, "I'm sorry this happened to you. Good luck in life." And
Mm.
that was like more of a slap in the face to me, where you had the opportunity to assist. That $25,000 would have helped me, would have cured all the things that I experienced. No, I wouldn't have, but it would have helped me get plenty, back on my feet and start to do something. So I took that again as they wanted to see me further fail. So I'm working during the day, I'm going to school at night, And my mom and my aunts were both professionals. My aunt, she believed in therapy, and so she told me that I needed to take therapy. So I was on my own, but
Mm.
thankfully I had my father, and I have something that most people who go through this don't have, and that's still their youth ahead of them.
Compensation, as we talk about the standard amount, maximum $5,000 a year, kept at $25,000. I mean, Wisconsin was a pioneer, 1913, leading the country in wrongful conviction compensation. What has happened to these efforts? What are your insights?
The petitioner has changed. So back in 1913, when this happened, the petitioner was not, majority of people of color
Hmm.
like it is now. And that's a derivative of the entire justice system and how disproportionately people of color are convicted more than their counterparts in the state of Wisconsin. And so we've found ourselves making it easily digestible to ignore the problem when a problem doesn't make it on the majority's doorsteps. And so if we could acknowledge that back in 1913 that there was some need to help correct and put people back on their feet, let's just look at the cost of living. If you do the calculations, then there's no way in the world that number shouldn't be somewhere around 50,000 to 75 to $100,000 a year. It's just right.
You are representing brothers, David and Robert Bintz of Green Bay. They're seeking $2 million each from the state for their 24 years spent in prison for a murder they didn't commit. What about $2 million? What do you think justifies that compensation?
The staff that I have in Wisconsin, everybody took turns like going through and making best arguments and looking at cases that were decided over the statute before. And we could find none that hit all of the hallmarks as this one. If this is granted, this would be the highest they've ever went over in 2 million. And here's our argument why. There was a case in which the legislators granted $1 million over the statute. And that was to someone who came home um, at the end of their 30s, about to approach 40. They still had opportunity to work until the years of retirement start to approach around 50, 55. In this case, Robert and David are home at 70 years old.
Hmm.
There's nothing they can do right now besides have their hands out and beg the community to push the legislators and everyone else to fix this situation for them. But they're also concerned about others who come out at the same age as they are.
What should be the model here? What would you direct the state of Wisconsin to do? Are there other states that are making inroads?
There are, shockingly, to probably some in the criminal justice community, Texas is really like leading the charge in what they do. They give mental health care support, they give healthcare support, and they also give little pots of money and resources to help with both like finding a place to stay. Like we're having the biggest problem with David and where he stays and where he's able to stay. The so is with Bobby, who's sickly a bit. It's hard to find places that will accept their 600 $700 a year um you know benefits money that they're able to get. And so in this situation, I think that there's an opportunity for us to endanger both the people we're releasing as well as the communities they're being released back into if we don't help. If there wasn't people like the Wisconsin Innocence Project, like the Great Northern Innocence Project, to assist after they were able to get people out, then there will be nothing. As well as the organization Life After Justice, is an organization I created to help with the mental health care aspect of it, where we are training therapists specifically to treat men like Bobby and David.
Hmm.
So they're getting help, but the help that they're getting is pieced together like a puzzle, and it's just not fair or right for tax-paying citizens as David and Bobby were before they were wrongfully convicted.
I want to circle back to what you experienced, and it really sounds like your family stepped in and provided that help and support when you really needed it. And with your organization, Life After Justice, helping people rebuild their lives after being exonerated, how do you see the role of nonprofits helping make up for what the state isn't providing?
I think specifically for my organization, and again, the organization, I found an organization in the spirit of my aunt that I told you about, who helped me get into therapy, I was in a breakneck pace to get my law degree because I wanted my mom and my aunt to be proud of me and know that they supported me for years, that weren't just for nothing. So I made this organization in her name because she saw something that I didn't really see right away. And she told me, she said, look, when life is a marathon, and when someone like you gets out like that, the first thing you need to do is not start running a race. It's tying your shoes. So mental health care to her was tying your shoes. There's no way that anyone can look and see what happens to men and women like Bobby and not think that they would have some type of mental impact from it. So in creating an organization, we are collecting data, and we are using the data to argue to legislators to do what is right. We understand that we're not big enough. We don't get enough donations and have enough therapists on deck to help provide therapy to all those who are wrongfully convicted. But hopefully, as we collect the data, we serve as an example to influence and argue to the legislators. Look, this needs to happen. This can save lives and it can protect communities. And that's what you swore to constituents that you would do.
Jarrett, thank you for sharing your story, and thank you for joining us.
Thank you so much for having me. I hope you have me again.
Jarrett Adams is an exoneree and attorney whose cases involve criminal defense, civil rights, and wrongful conviction in state and federal courts. His memoir is called Redeeming Justice. We earlier heard from Khushbu Rathore from Wisconsin Watch. They both talked to Kate Archer-Kent about the impact of state compensation for people who are wrongfully convicted. Still ahead on Wisconsin Today, preview a new documentary that tells the story of women who work as exotic dancers at a club in rural northern Wisconsin.
Yes, it can be uncomfortable at times, but a lot of the issues that are dealt with are issues that any of us can go through.
That's next here on WPR News. You're listening to Wisconsin Today. Time now for Wisconsin Life. Here's producer Maureen McCollum with a story about reflecting on safe spaces.
Many of us have places that make us feel comfortable. Perhaps it's a bookstore or a bar. For writer David Shee, it's a place much bigger. He shared the following story about that space at a live Wisconsin Life storytelling event in Eau Claire at the Lakely.
Last November, the city where I've lived for the past 25 years suddenly felt a bit more like home. Eau Claire was finally getting a Costco. Don't get me wrong, I shop locally when I can. Still, I'm left to wonder how an outpost of a multinational corporation can beckon to me with such hospitality. It has something to do with my father, who loved warehouse clubs, and whose death 5 years ago occasioned the writing of my memoir, Chinese Prodigal. In the 80s, shopping wholesale in the North Dallas suburbs where I grew up meant Sam's Club. Its monstrous sleeves of beef jerky rode shotgun to my father in his commercial cube van. A small business owner, he drove it hundreds and sometimes thousands of miles a week to trade shows across the South. In 1999, when, at age 65, he used that same cube van to move my fiancée Robin and me to Eau Claire, I think it was a great comfort to him that my new home rated a Sam's Club at least. David will be safe here, he may have thought. In time, my parents grew to prefer Costco. It pained them to pay retail for anything. But Costco's appeal must go deeper than how much they liked a good deal. Asians are almost twice as likely to shop there, as are other racial and ethnic groups. Maybe part of it is recognizing the food from home in a way that makes you feel seen and not tokenized, because there is a ton of it. In our Costco, I saw a pallet with hundreds of golden jars of ghee, stacked as high as my chest. They're never gonna sell all that ghee here, I thought. Nevertheless, there it sat, next to the more popular baking supplies, not segregated into a specialty ethnic aisle. But the appeal of Costco is more than being seen by it. For my father, I think cavernous warehouse clubs were like a safe space, offering an uncommon anonymity amid the crush of public life. He loved having the time and the elbow room to study something you wanted from all angles before arriving at your own decision and on your own terms. He never got comfortable speaking English with salespeople. Outside of the house, like so many immigrants, he usually just wanted to be left alone. But that didn't mean he wanted to be alone or to feel that way in a crowd. One dark winter evening, Robin and I hit up Costco just for fun. The parking lot was lit up like a truck stop, but mostly empty. It was so unlike every other Costco I had been to, all of them unfailingly packed with humanity of all colors and ages. I snapped a few photos to brag on social media to my people in Texas about how good we had it up here. At that moment, I knew a couple of things to be true. One was that I wasn't going to be the only Asian inside. The other was that, despite my eagerness, I couldn't say what it was exactly that I needed from there. Thank you.
David Shee shared that piece at a live storytelling event in Eau Claire at the Lakely. It was hosted by WPR's Wisconsin Life and the Chippewa Valley Writers Guild. To hear Shee's full story, go to wisconsinlife.org or check out the Wisconsin Life podcast. Wisconsin Life is a co-production of Wisconsin Public Radio and PBS Wisconsin in partnership with Wisconsin Humanities. Additional support comes from Lowell and Mary Peterson of Appleton. I'm Maureen McCullum.
This is Wisconsin Today. Starting this week, the Beloit International Film Festival will screen dozens of films from around the country. Green Bay-based director Paige McKenna will be there, screening her sophomore documentary called Gold. It follows the lives of 5 exotic dancers in rural Wisconsin.
We really got to experience the depths of these girls' lives with them and really see how life unfolded for them and what the options that they really had were. And they're not always the same options that somebody who's come from a life of more privilege and less trauma may have. I feel like I have to be a good example to these young girls because they're never going to get sober themselves if they don't have somebody else who's showing them that they can.
WPR's Lee Rayburn spoke with Paige McKenna and Miss Dusty, one of the women featured in Gold, about how the club provided a space for those women to discover bodily autonomy, something they didn't always have outside of dancing, and the financial and emotional support many of them needed to move towards sobriety. Paige started by telling us a little more about what audiences can expect when they see the film.
Gold takes place at a club in northern Wisconsin in the town of Spread Eagle, which is a real town. And the club is called the Gold Nugget. It's a very small club run by a former dancer who was a dancer in the 90s. She goes by Dusty. And the film follows 5 different women's stories, whether they're dancers currently working at the club or have worked at the club in the past. I've been lucky and fortunate enough to get to know them and to create this project that empowers women in the sex industry, as well as empowering people to see their worth, their value, and to leave abusive relationships and focus on bodily autonomy as well.
And Ms. Dusty, a lot of the ways that you and other women in the documentary talk about exotic dancing is in the language of empowerment, and Paige mentions that as well. And it's not necessarily someone would generally assume people would feel about this job. Can you explain more about how women find empowerment through exotic dancing?
Well, I can tell you how I felt when I got into that. When I first started, I was very low self-esteem. basically a bar butterfly, or we call them a barfly. So I didn't think I was much of anything. But once as time started going on, I don't know, I just kind of discovered slowly but surely that these guys were giving me a power I didn't know I could have. Because with my marriage, it was whatever he said I did.
Your first marriage.
Yeah. So to be able to walk away from that control was very empowering. And I was able to get in the habit of telling men no. I was able to tell him no. Women find that inner strength that they don't need to be controlled by a man. They don't need to have a man in their life. It was very important to me.
Paige, what made you want to tell this story about the Gold Nugget and Miss Dusty?
With all of my films, I try to uplift and empower groups of people who have been historically marginalized. I also wanted to learn more about that world myself. So selfishly, I was very curious about women in this industry and, why they choose the paths they do and, what's next for them and things. And when I heard that the club was, run by a woman, I definitely, my ears perked up. So when I had met Dusty, she was very reserved, and I don't blame her at all. I remember we had lunch together and she didn't look me in the eye the whole time. And at that moment, I thought, well, this is going to be a little more difficult than I had expected as far as gaining trust. That is something that, if no one were to see this film and if it were, to not be successful at all, at least I have cultivated this sisterhood with Dusty and with the women, and, they've trusted me to tell their stories, and I can't think of anything that's more fulfilling than that.
We're talking about the new documentary Gold with director Paige McKenna and Miss Dusty, the owner of the Gold Nugget, the club this documentary is about. And Paige, curious to know, do you feel differently now than you did going into this project?
Oh, yes. So I grew up in a Catholic environment, pretty strict Catholic. So, a lot of my self-exploration journey through this process has been really interesting. It's been fairly uncomfortable. I found myself, the first time I stepped foot in the club was the first time I had been to a strip club ever. So I, had to work through a lot of my own uncomfortabilities. And I think I had met Dusty before I had met many of the other women in the film, but I had formed kind of these opinions of the women in front of me at the club. And instead of projecting that judgment, I guess, on them, I just looked internally and I was like, why am I feeling this way? Why am I coming up with these stories about people that I haven't met, haven't had conversations with? And I think that was valuable for me as a person to grow, especially given the political climate lately. It seems like people are very, very against each other and quick to judge. And so for me, that was something I really was able to grow based on this experience. Like a lot of the women talk about in the film, I've had issues with women as well, and, friendships and things. And I just think, like, if we all just supported each other and had, less judgment, I think, like, the world would be a better place. And I think we'd have stronger communities. And I hope, the women kind of feel the same way, that they've grown through this. I know that they've said that they, have felt almost relieved and have felt, a sense of bravery with sharing their stories. And to me, that's more than, any recognition is worth.
Paige, your debut documentary, Seeds of Life, won a few awards and was screened at film festivals in the U.S. and Canada. Has it been easier this time around with your documentary Gold?
No, actually, it's been a lot more difficult, which is, not something I expected. I'm not sure what the, reason is for our many rejections so far, but we really have gotten a lot. We actually got disqualified from a film festival that had invited us to apply because of the nudity, not full nude, but, topless women. And then they had, the film Anora has won, 5 Oscars this year.
Right.
And this film festival had, kind of sent out a mass email mentioning Anora and how you should apply to this because your film could be the next Anora. And that rubbed me the wrong way because I thought, well, Anora would have been disqualified for nudity as well. A lot of people were asking me if I was a dancer because I was doing the film. And I just thought, my knee-jerk reaction was kind of like, well, nobody asked if I was a nun when I did my last film.
Which was about a nun.
Yeah, yeah. And so, I don't know what it is. I don't know if people are still really, fearful about talking about the sex industry and about, having women being shown in this empowering light in the industry. We've just been running into these roadblocks that for me are very frustrating because I do want the film to be seen. Yes, it can be uncomfortable at times, but a lot of the issues that are dealt with are issues that any of us can go through. And really it's just, we don't have the same, career path. We don't have the same job as these women, but we deal with what they're dealing with on an almost daily basis as well. So it has been frustrating.
Miss Dusty, what are you hoping people take away from seeing the documentary Gold?
What do I hope? That no matter what you do in life, whether you come from a rich family or a poor family, that you're human. You're a person. Domestic violence is so rampant and has been for many, 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 too many years. And it's time that younger girls are taught not to be controlled in that aspect, but to grow and be strong and remember to take care of themselves first before they worry about a relationship.
For listeners who are curious, where can they go to see the documentary Gold?
So we will be showing it at the Beloit International Film Festival on March 30th at noon. It's a Sunday. And then it'll show again April 2nd at 7:30. You can buy tickets at beloitfilmfest.org. They don't have any tickets for sale at the door, so you'll have to get them ahead of time.
Miss Dusty and Paige, thank you both so much for joining us today.
Thank you for having us. We appreciate it so much.
Yes, definitely. Thank you.
That was Paige McKenna, creator of the new documentary called Gold, and Miss Dusty, the owner of the Gold Nugget, the Northern Wisconsin club the film is about. They spoke with Lee Rayburn. Later this week, I'll talk to a Wisconsin researcher who works with people who use wheelchairs. The goal is to prevent repetitive motion injuries, make wheelchairs more user-friendly so people can stay active, and avoid damage to their shoulders, elbows, and more. So here's a specific request for some feedback. Do you use a manual wheelchair? Have you had trouble with repetitive motion pain or other problems just based on the muscles you're using and how often you use them? Have you found some good solutions to those worries? We'd love to share your story in a future program. Email wisconsintoday@wpr.org or call or text to get in touch at 888-642-0232. If you have a friend or loved one who uses a manual wheelchair, please pass that request along to them. Again, the email wisconsintoday@wpr.org. Wisconsin Today is the work of a team of producers, hosts, and technical directors. Learn more about us at wpr.org/Wisconsin Today. I'm Rob Ferrett. You're listening to WPR News.